Hi, I'm Matt Norvell. I'm one of the chaplains at Johns Hopkins Hospital, and I help develop a peer-to-peer program to support caregivers who feel like a second victim. The program is called RISE, Resilience in Stressful Events. It's been very successful here at Hopkins, and I think it'll be valuable in your clinical setting too. Here's the idea behind RISE. Everyone who works in a clinical setting anticipates a certain level of stress when caring for patients, whether you work at a busy, complex health system or a small community hospital. But sometimes you're involved in an unanticipated clinical event like a patient death or a medical error. You may have a problematic or unpleasant run-in with a patient or their family, or your treatment plan does not end successfully. No matter how you get there, the result is you feel traumatized. Too often, traumatized caregivers turn inwards. Maybe they choose not to seek help, but more often they want help but just can't find it. Who can you talk to who understands what you're experiencing without being judgmental? Who can offer coping strategies to get you back to a state of well-being? Who can reassure you and guide you so you can continue to thrive at your job? And perhaps most importantly, who can be trusted to keep your situation confidential? RISE is a service you can implement at your hospital. It's staffed by your peers: nurses, doctors, therapists, pharmacists, chaplains, even project coordinators. These folks are specially trained and are on call 24 hours a day, 7 days a week, to provide confidential support for their distressed colleagues. The key component of RISE is the conversation between peers. It can take place wherever is most comfortable and convenient for the RISE volunteer and the person in need. That can be by phone, or it can be in a small conference room away from the clinical floor. Can you tell me some of what brought you to the RISE program?
Well, the other day I was seeing patients, as I usually do on Thursday morning, and I just finished with someone, and there was a woman waiting outside of my office, and she used to be my patient. I hadn't seen her for a while. And she said, "I had to talk to you. My husband is dead, and it's your fault." And I got this, feeling in the pit of my stomach. I said, "Well, what happened?" And I remembered her husband, and she said, "You said that he had bursitis in his shoulder, and it was lung cancer."
Oh, wow.
And I remembered that he'd had shoulder pain, and he couldn't move his shoulder, and I got an X-ray, and there was something there. But she told me that the pain really was from lung cancer, and if someone got an X-ray later, and his lung was full of fluid, and he died. And she was very upset. She said it was my fault. And I felt awful.
Well, you've been a doctor for several years now, and I'm sure you've had patients die unexpectedly before. What was different about this situation that you needed some help?
Well, it doesn't, just because you've been in practice for a while doesn't make it easier. This was just really hard.
And why in this situation did you reach out to the RISE team as opposed to a colleague or someone else that you work with?
It was a little embarrassing, frankly. I felt like I'd missed the diagnosis, and didn't really feel like I wanted to let anyone know about it.
So let's talk a little bit about the RISE interaction specifically. How did you even find out about the RISE program?
Well, right there in our workstation, there was a screensaver right on the monitor that, said RISE, and if you wanted help, you could call, and it was perfect timing.
Mm-hmm. So did you call them? Did you send them a page? How did you get a hold of them?
Yeah, I just called the number, and someone picked right up, and it was easy.
Great. Did you get a chance to meet that day, or how long did it take?
We met We met just actually in less than an hour after I got out of the clinic. We just met up, and yeah, it was really just when I needed, when I needed it.
Can you tell me a little bit about that interaction? How did that go for you?
The person who I met with, she was very comforting, and I think she really mostly listened. But the funny thing is that after we were done, it was only about 20 minutes, I really felt a little better. She helped me understand it really wasn't, that it probably wasn't really all my fault. And I knew that, but that's not exactly how I felt. And so I think I had a little better handle on it by the time we were done.
Is this something that either you would use yourself again or that you might recommend to one of your colleagues?
Well, I hope I don't have to use it again ever, but I'd certainly recommend it to a colleague.
To help bring RISE to your facility, we've developed a program called Caring for the Caregiver, Implementing RISE. It's a self-taught, self-paced program that includes all the information that you'll need to understand issues around being a second victim and to offer RISE in your facility. To get you started, you can participate in the RISE one-day workshop. This is a Train the Trainer teaching seminar that's taught by members of the Johns Hopkins RISE team. The workshop includes strategies to get buy-in from your leadership and how to navigate the operational challenges you'll likely face. You'll learn how to recruit and retain peer responders. You'll also learn how to improve their skills. And you'll learn strategies for rolling out and sustaining RISE at your facility. At the end of the day, you'll leave the workshop with all the materials that support the program. The RISE Assessment Roadmap. This is an online checklist of items you'll need to successfully bring RISE to your organization. Articles, sample policies, sample organizational charts, resource lists, and sample cases. You'll also get learning quizzes and forms and templates to engage your colleagues and to become a RISE volunteer to use the service. You'll get training exercises and hints and tips to help guide you as you bring RISE to your colleagues. You'll also have access to video vignettes that present experiences of participants and program experts. All of these materials will be available through the Maryland Patient Safety Center. To keep you on track, we offer support through telephone consultation. And to help keep you current, you'll receive a quarterly e-newsletter that updates you on the latest second victim research and experiences of other organizations. Can you tell me a little bit about what brought you to the RISE team?
Well, there was this little boy. His name was Sam, and he had brain cancer. And I was one of the nurses that cared for him for a couple of years. And Sam and I, well, we got pretty close. We trusted each other. And one day, not too long before the end, he asked me if he was going to make it. And I didn't know what to say to him, but I told him that it didn't look good. Well, after I left him, his parents came to visit, and they were outraged that I had said this to him. His father came looking for me and really got in my face, was yelling, was very intimidating, told me that it was none of my business to tell his son that he was going to die. Definitely accused me of taking away all of his hope. And then a week later, as we expected, Sam died. And again, I tried to talk to the parents afterward, and his dad, well, I don't exactly remember exactly what he said, but it sounded like basically, "Thank you for killing my son."
Wow.
And that, well, I've been a nurse for 25 years, but that really threw me.
Yeah, that sounds really intense. And The thing I'm wondering about is, since you've been a nurse for 25 years, you've probably encountered intense situations like this before. What was different about this time?
Well, I guess a number of things. I mean, it was the combination of how angry his dad was, for one thing. I mean, he was scary. He was really almost physical, and I felt physically intimidated. It was obviously losing Sam and losing him the way I did, but also I think it was the dad put a little bit of doubt in my mind. I had to wonder, you know, did I shorten his life by telling him the truth? And again, I was just so exhausted after all this and really sad. And so all of that really made me question.
Gotcha. So, again, you've probably been in situations like this before. What made you call the RISE team this time instead of talking to one of your peers or one of the physicians involved?
Well, I've had doubts before, but these doubts were different, and it really had me questioning whether I'd done the right thing. And I didn't exactly want to tell the rest of my team that I might have done something wrong. And if I had done something wrong, I didn't really want to implicate other members of my team.
I see. So you called the RISE team. Can you tell me a little bit about that interaction? How did you even know about them? How did you get a hold of them?
Well, there were these cards from RISE that were on my unit, and I'd been seeing them around for a long time, and I'd taken one. After this happened, I was really glad I did. So I called the number in the card, and I left a voicemail. And it wasn't very long at all until a member of the team, a woman named Carrie, called me back.
So you and Carrie met that day, or how soon did you meet?
It was after I got off my shift. I told her I didn't want to meet on the unit, so she agreed to meet me in a very close by, convenient spot that was neutral, that nobody would necessarily know why I was meeting with her.
Oh, that makes sense. So you met off of your unit.
Yes.
Right. So can you tell me a little bit about that interaction? You don't have to retell the whole story, but was it useful for you, and if so, how?
Carrie was fantastic. It was so helpful. When I first met with her, I was feeling all these emotions. I was so upset. I was kind of all over the place, and she really helped me focus and think through what my questions were. And she helped me sort of talk through them so that I really realized, you know, what I thought I had done was right and why.
Is this something that you would recommend to one of your peers?
Absolutely, absolutely. This took a lot of weight off of my shoulders. I'd really been carrying it around, and it really made a big difference for me.